Good afternoon, my name is Lugosi Katalin and I am a neurologist in Bajcsy-Zsilinszky Hospital. My PhD thesis is cognitive impairment in multiple sclerosis, clinical and demographic determinants. My supervisor is Zsolt Mezei. He is a neurologist in the Department of Neurology, Semmelweis University. My vision is to give a comprehensive epidemiological insight into cognitive dysfunctions of multiple sclerosis by understanding tendencies and relationships with clinical parameters. And our mission is to assist in planning further researches and selecting the most appropriate therapy in MS cognition. Our first topic is cognitive domains impairment in different subtypes of multiple sclerosis with clinical and demographic determinants. In order to understand different cognitive impairment patterns in multiple sclerosis, our second project is deciphering wide range of prevalence rates in cognitive impairment of MS, recommendation for clinical practice, in order to understand differences of published prevalence rates. And our third project is establishment of an early stage MS registry. So about the first project, we are currently working on the manuscript, mainly, especially on the results part of the manuscript, and our target journal is the JAMA Neurology, which is a D1 journal. A few words about the background. So cognition, our way of thinking, it contains 5 main neurocognitive domains: memory functions, executive functions, attention, language functions, and visuospatial perceptions. And every individual cognitive domains can be measured by different neuropsychological tests, as you can see in this picture. And all of them are the BRBN test battery, the brief repeatable battery of neuropsychological tests. We have chosen this neuropsychological test battery because it has the highest sensitivity and specificity. And multiple sclerosis is a chronic demyelinating, disabling neuroinflammatory disease, and it has 4 main clinical phenotypes. The clinically isolated syndrome, this is the very early stage of the disease. The relapsing remitting multiple sclerosis, this is the most common form of MS, with relapses and remissions. The primary progressive multiple sclerosis with early progression, disease progression from the beginning, and the secondary progressive multiple sclerosis, which develops from relapsing remitting form. Our clinical question is, what is the prevalence of cognitive domains impairment in different subtypes of multiple sclerosis? Our hypothesis is progressive forms of MS have the highest prevalence, and information processing speed domain is the most affected cognitive domain in relapsing remitting multiple sclerosis. Our secondary outcomes will be the demographic, I mean age, gender, education, and clinical EDSS score. This is a physical score of MS, and this is duration determinants. Here you can see our systematic search and our flowchart of selection. Finally, we have 51 eligible article for meta-analysis. And here you can see our first results with the separate cognitive domains impairment in each subtypes of multiple sclerosis. At the top of the forest plot, you can see the clinically isolated syndrome group, after the primary progressive multiple sclerosis subgroup, after the relapsing remitting multiple sclerosis, and at the bottom of the forest plot, you can see the secondary progressive multiple sclerosis. And you can see in all of the domains that significant differences are can be noticed between the different subtypes of multiple sclerosis. Here you can see other neuropsychological test measurements. And in order to better understand the comparing different cognitive domains, I show you this summary table, and you can notice, and we have proven that in the relapsing remitting multiple sclerosis, the information processing speed and complex attention has the highest prevalence rate of cognitive impairment. And the progressive forms of MS have the highest prevalence rates in all cognitive domains. And there is a very interesting finding in our meta-analysis that the language function, verbal memory, has the highest prevalence rate in primary progressive form of multiple sclerosis, not in the secondary progressive multiple sclerosis, instead of all of the cognitive domains. And it is a very important and very interesting measurement and finding because of the neurorehabilitation programs. And for summary, implication for practice and research: if we know the most affected cognitive domains and most affected phenotypes in multiple sclerosis, the clinical impact will be individual treatment and neurorehabilitation programs. The research impact will be planning the most reliable study design for future studies. And if you know determinants and what does the degree of cognitive impairment depend on, it has clinical impact as highlight patients at risk, as you can see in the primary progressive multiple sclerosis. And the research impact is targeted examinations in other influencing factors. Strengths: to the best of our knowledge, this is the first comprehensive meta-analysis over the entire world in detailed prevalence of cognitive impairment in multiple sclerosis, and it helps to better understand the context of cognitive impairment. This is a comparative analysis of different phenotypes and domains in MS. And limitations: most of the data are from RRMS, of course, because this is the most common form of MS, and we have potentially greater error bias due to very diverse data. I am moving on the second project, deciphering wide range of prevalence rates in cognitive impairment of multiple sclerosis. So the fact is the prevalence of overall cognitive impairment in MS has been reported to range between 40 to 70 in the literature. Our hypothesis in this project that the reason for this wide range is the difference between the neuropsychological tests and cutoffs used to measure cognitive impairment in multiple sclerosis. So the conclusion is, the preliminary conclusion is, everyone defines cognitive impairment in multiple sclerosis differently. That's why our aim is to provide a comprehensive overview with the definitions of cognitive impairment in MS and to find correlations between the prevalence values and clinical demographic characteristics. And maybe our final goal will be to give recommendations in regard of which test and related cutoffs are the most reliable for clinical and researchers based on our previous findings. The systematic search is the same. Here you can see the flowchart of selection. We have more than 100 eligible articles with the generally MS population, and also more than 100 eligible articles with the different MS subtypes. And our outcomes will be the prevalence of overall, so here is the overall cognitive impairment for phenotypes of multiple sclerosis using all neuropsychological test batteries, which are used in the literature, and comparing the prevalence rates across different used tests and cutoffs values. How do these dependent variables influence the results? And when comparing the results to clinical and demographic parameters, give recommendations. And we are currently working on the result parts of the second project. So the third project is a registry, establishment of an early stage registry, because one of the biggest challenges currently associated with the research of MS cognition is to find a prognostic marker which can be sensitive to progression of cognitive impairment. And our aim is to find an easily usable, inexpensive prognostic marker in early phase of the disease, which predicts reliably the future progression of cognitive impairment. Our patients are clinically isolated syndrome. It means diagnosed within 1 year. And we plan to measure different aspects of MS, the clinical and demographic parameters, cognitive affective aspects of multiple sclerosis with different neuropsychological test results. And we are planning to screen our patients annually. And finally, our aim is to find a widely usable prognostic marker for further cognitive deterioration of multiple sclerosis. So for summary, we are at this stage And our aim is to understand what does it mean exactly cognitive impairment in multiple sclerosis, how does it correlate clinical and demographic parameters, what are the most ideal neuropsychological test and cutoff value to assess cognitive impairment in MS, and what are the prognostic factors in progression of multiple sclerosis. So thank you for your attention with Aldous Huxley's words. Why it is important to measure the cognition in MS and cognition in neurology, because every man's memory is his private literature. Thank you for your attention.